Hello everyone, I'm Dr. Madeline Fernandez and welcome to Diabesity Dialogues. Here with us today we have Dr. Awais Pathan sir. He's a consultant diabetologist at the Pathan Diabetology Clinic in Mumbai. You're very welcome sir to this program here today.
Thank you.
Sir, we are celebrating World Diabetes Day and we know that the prevalence of diabetes, it's very high, not only globally but especially in India. We have around 101 million people who suffer with diabetes. So on this podcast, we wanted to create awareness about diabetes and to just enlighten everybody about the current management that we have in diabetes. So, sir, we wanted to know what exactly is diabetes and how does this condition affect the millions of people who suffer from it?
Yeah, let's start with the basics. So, diabetes is a metabolic disease. Diabetes is dysfunction of the pancreatic beta cells. In that, there are two mechanisms at play. One is decrease in secretion of insulin, the other is insulin resistance. The decrease in insulin secretion is because the pancreatic beta cells of Langerhans are a lot of them die, and because of the decrease in the quantity of the number of beta cells, the amount of insulin secretion capability of a human being goes down and hence the patient becomes diabetic. The other pathophysiology that you see is because of obesity, because of excessive fat in the belly, because of excessive fat in the liver. This causes insulin resistance. So the amount of insulin that is being produced is already less. On top of that, the ability of the body to use this insulin also decreases, and hence the sugars in the body, in the blood, starts to increase and you get a diabetic patient. And diabetic patients are generally hereditary. It is a hereditary phenomenon, and because of certain genes that are transmitted from father to or mother to their children, you get a family having a history of diabetes.
So why are we seeing diabetes rise, especially in the young and adolescents today? And how is belly fat associated with reduced insulin sensitivity?
So diabetes, if you see nowadays, is seen in younger and younger individuals, especially the type 2 diabetes, which was never seen in the younger individuals. It's type 1 diabetes that was seen in the younger individuals, but now even type 2 diabetes is seen in younger and younger individuals, and that is to do with our lifestyle. We have adapted the lifestyle of the West, of fast foods, and because of prosperity also in this country, people are able to spend more. So they don't spend it on healthy food, they spend it on all these quick foods which are called fast foods, which are laden with carbohydrates and fats, due to which our younger generation is becoming more and more obese. And as I explained earlier, insulin resistance is one of the causes for type 2 diabetes. So that's why that is one. The other thing is, no one is going to the gym, no one is going for a swim. People are all exercising on their phones, their only thumbs are being exercised, and even they call for food on all these apps. So movement is not there, hence there is no utilization of glucose by the muscles, and hence again, as I said, the insulin resistance goes up, and that's why you see type 2 diabetes in younger and younger individuals. Having said that, how does belly fat reduction help? Obviously, as I just said, that once you lose adiposity, which is your belly fat, you decrease the amount of insulin resistance, and once you decrease insulin resistance, if it is caught in earlier stage, so pre-diabetic can be pushed to a non-diabetic, and a diabetic also can be, early diabetics can be pushed to pre-diabetes. So losing weight is one of the core pathophysiological hindrances when it comes to type 2 diabetes.
So the next question that we have is, how can individuals know if they are at risk of diabetes, and what are the early warning signs should one look for when they are at risk of diabetes?
Yeah, so as I said earlier, type 2 diabetes is an inherited disease. So you have to look at your parents, your grandparents, your uncles, aunts, to see who is suffering from type 2 diabetes. If you do find someone suffering from type 2 diabetes, understand that you are at a risk of developing type 2 diabetes. Once you've ascertained that yes, there is someone in the family tree who has type 2 diabetes, then the other thing you have to make sure is you do not put on weight, especially belly fat. Your waist circumference is an independent risk marker for type 2 diabetes. So making sure that you don't put on weight, you eat healthy, and you exercise daily is the most important factor that will take care that even if you are getting inheritance from your forefathers of type 2 diabetes, by staying thin, making sure you don't have belly fat, and by exercising daily, you will push that coming diabetes much later on in life. So it will come very late in life. So that is what you can do. How do you know if I have got diabetes today, yes or no? Well, one of the things is you will have frequent urination, uncontrolled urination. You will have, wounds that do not heal. You will get itching in your skin. You will get excessive thirst, weight loss, giddiness, headache. These are all telltale signs that you could be diabetic. So please consult your doctor, do a sugar checkup, and consult your doctor if you do think that you have got any of these signs and symptoms.
So since you have mentioned that diet and exercise play an important role, and even sleep is an important factor in improving insulin sensitivity. Could you let our audience know what are the small realistic goals that they should keep in order to prevent or...
Yeah, diet and exercise forms the mainstay. Even today, every diabetologist, every endocrinologist, and everyone who's treating diabetes will write diet and exercise right there, lifestyle modification. It's called lifestyle modification. The point is that you have reached this stage in your life is because you've been leading it in a wrong way. Hence, we need to modify that lifestyle. So hence it's called lifestyle modification. So every day going out for a walk, a swim, cycling, gym, any kind of exercise where you move your body, you utilize your muscles is very important when it comes to a diabetic. Not only diabetic, every individual should exercise daily if they do not want to fall into the trap of obesity. So that is one part. The second part is making sure that your diet consists of good fruits, different colored fruits, different colored vegetables. Yes, you can have your proteins, you can have your meats, but make sure that you have the healthier meats like white meats, and make sure that you have more amount of proteins and lesser amount of carbs. These are some very simple ways to make sure that you stay healthy. I do not have a problem with rice, but the quantity of rice is very important, and make sure, as I said, that you have more proteins. So having more chicken than the rice in your chicken biryani would be the right way to eat a chicken biryani. I'm not saying don't eat a chicken biryani. I can understand you falling for, in a land like India, if you don't eat chicken biryani, then what kind of an Indian are you? But if you do have to have the chicken biryani, make sure you eat the rice little and have more of the chicken. Similarly, for our vegetarian friends, you make sure you have more of the dal in your dal chawal than the chawal, and more of the veggies. So what happens is you get proteins, you get fibers, you get vitamins, and you're taking a lesser amount of carbohydrates. So, sprouts, using more sprouts, using more dals, which give you protein, using a lot of chas when you drink. So these are some things by which protein in vegetarians also can be increased and the carbohydrates can be decreased. So these are some practical tips basically that people can take away, and by doing this, make sure that they are healthy.
So what are the current therapies in the management of diabetes? And GLP-1 RAs are currently the talk of the town. Can you throw some light on it?
Yes. So having said that the number of diabetic patients have increased, you also need to understand that because of the increase in diabetic patients, the research in diabetes has increased, and because that the kind of therapies that are available to us as of right now are wonderful. A plethora of medication is available to treat different types of diabetes and different pathophysiologies in diabetes. One of such medication is the GLP-1 RA. Now GLP-1 RA has been with us for more than 15 years. Exenatide, liraglutide, lixisenatide, now semaglutide, tirzepatide. So we have a lot of GLP-1 RAs with us. The new talk of the town being the semaglutide injectable and the tirzepatide injectable, where a lot of weight loss is seen. And I explained to you earlier the insulin resistance and the belly fat causing diabetes. So hence the weight loss that patients get with these drugs really changes their life and really changes the paradigm in which they were heading towards in terms of the disease. So they really modify and they change the direction in which the patient has gone in terms of the disease and its complication. Now, having said that, they are not very cheap, but the kind of protection that they give the liver and they give the heart and they give the kidneys, I think so they more than justify their cost. cheaper GLP-1 RAs like liraglutide is definitely available in India, and I think so. The reason being the pathophysiology of an Indian diabetic, the genome that is there, that down to the gene level, the pathophysiology that we have, really drug like liraglutide really, or a GLP-1 RA basically really hits it really hard and attacks the pathophysiology very well. And as I said, we have the availability of the cheaper GLP-1s to the expensive ones. So from our poor to our rich, everyone can afford a GLP-1 RA.
Coming to our final question, sir, if you had to leave one final message for all our viewers today, and considering that World Diabetes Day, what would your message be?
So I have a few messages, not a message. For my diabetic patients, the message would be keep your sugars under control, eat healthy, exercise daily, and make sure you visit your doctor regularly, do your checkups regularly so that you can keep your disease under check. To my non-diabetic patients, friends, I would say please eat healthy, diet properly, exercise daily, do not put on weight so that you do not become my patient. And for the rest of the country, eat healthy, exercise daily so that we stay healthy and prosper. Thank you.
Thank you.